Gaming and casino lights dimmed, businesses forced to close their doors to stop the spread of COVID-19. Now, Nevada is estimating a revenue shortfall between $741 million to $911 million for the fiscal year that ends June 30th. Governor Sisolak declaring COVID-19 strain on public services a fiscal emergency. This allows the governor and the interim finance committee, a committee that functions when the legislature is not in session, to transfer money from the rainy day fund to the general fund. Right now, the rainy day fund sits at $401 million.
The declaration was expected. It was the right thing to do. It's the first necessary step so that the state can begin to access what we call the rainy day fund.
Mike McQueen with wealth management firm Hightower Las Vegas says those funds have been accumulated for a situation exactly like this. Reserves from state agency budgets can also be used to help with the shortfalls. In a statement, Governor Sisolak says, while we appreciate the additional assistance from the federal government to help address the immediate funding need for the public health crisis, the state is now in a position where we'll be forced to make very difficult decisions. Governor Sisolak says all options must be brought to the table. He is working closely with partners in the legislative branch on these decisions, including if and when to hold a special legislative session.
It's about fixing a hole in a budget, which is what hundreds of thousands of families are doing across Nevada right now, fixing a hole in their personal budget. The state is doing exactly the same thing.
On it and fought through it. At the UNLV Med School, they are mounting a massive drive-through testing effort. Jeff Gillen shows us how it could be an important weapon to help keep the outbreak here tamed.
Good evening, everybody, from a room here on Charleston Boulevard. What happens here could help treat COVID-19. Since March 24th, the UNLV Med School has administered more than 7,000 drive-through tests. About 770 people have tested positive. So the process that started here,
are you having any symptoms?
Continues here in a suite of med school offices.
No fever, cough, otherwise shortness of breath.
UNLV Med School resident and young doctor Aman Shafi is contacting people who recovered. Turns out their body has something very valuable. That's why the school is asking them to donate a part of their blood called convalescent plasma.
Is that something you would potentially be interested in?
That plasma contains antibodies that fight the virus. Dr. Angelica Hansberg specializes in internal medicine and pulmonology.
So we're hoping that by giving those antibodies to patients whose immune systems seem to be having a harder time handling the infection, we'll be able to give them more of a boost and help them get better faster.
At UNLV, they've gotten drive-through testing down to a science. These students and doctors take reservations. It's appointment only. And doctors like Dodd Samangan call back with results.
A lot of people, especially when they get the negative results, they definitely have a lot of relief.
The relief among professionals is that Southern Nevada stayed home. We social distanced, keeping a COVID-19 wave from hitting local hospitals. Dr. Hansberg does duty in the ICU.
We did not have to worry about running out of ventilators. We had protective equipment, and I think it's one of the reasons that we were able to have, or have been able to have, very good outcomes.
For med students, it's been quite the education. Dr. Mark Kahn is the dean.
You know, physicians and student physicians have always been on the front lines of epidemics. It was polio, it was diphtheria. In my lifetime, it was HIV.
And in his lifetime, it's COVID-19. Quite the education and quite the opportunity.
But I think we're all blessed to be in a position where we are able to help and to make a difference.
So that people get better. In Las Vegas, Jeff Gillen, News 3.
Well, that's right, Marie. If they haven't already, voters will soon be receiving their mail-in ballots. Election officials are encouraging this type of voting this year because of COVID-19. Now, traditionally, election officials would recruit thousands of volunteers to man polling places all around the state. But this year, they chose not to do that, in part because they didn't know how long the quarantine restrictions would last. And also, many of the poll workers tend to fall in that high-risk age group. So the mail-in ballots are pretty self-explanatory. There's a return envelope. You simply have to mail by primary election day, which is June 9th. You do have to be an active registered voter to receive a ballot, meaning if you've moved since the last time you registered, you likely won't be getting one.
Every ballot comes with a postage prepaid ballot return envelope, and the ballot return envelope is also pre-addressed to your county election official. So it really is as simple as marking your ballot, putting it in your ballot return envelope, signing your ballot return envelope, and then sending it back to your county election official at no cost to you.
Now, there will be limited in-person polling places for both early voting, which begins May 23rd, and on Election Day. Election workers will be practicing social distancing. They will be wearing masks, and voters are encouraged, if they choose that option, to wear masks as well. But mail-in, obviously suggested this year, Marie. If you don't receive the ballot by the end of this week, you can head to the website mailinnevada.com for more information. And we've posted some useful links on our website as well. Back to you.
Leave it up to Dana White. You know, the pandemic has been very tough on a ton of sports, and spring football was one of the casualties, of course. So there's no denying that this first offseason for new UNLV football coach Marcus Arroyo has been very challenging. Our Jesse Merrick has a story on how the staff had to adapt to the times.
There's no tab for this. If there was, I missed the email.
Yeah, I'd say we all missed that memo, and obviously missing the on-field work is tough for a staff in their first year, but Arroyo says there's more to it than just missing those reps.
The coach-to-coach interaction, the coach-to-player interaction, and the player-to-player interaction on a field, there's a ton of information there that you get that we don't have yet, unfortunately.
So without that, they've had to adapt to a virtual spring.
The key to it is making sure we're hitting culture, make sure we're hitting mindset. We're letting our guys have check in on their health and well-being with their families. I've got parent Zooms to make sure they're connected and they're updated.
On top of all that, they're installing Arroyo's system through video chats, doing player-led workouts to stay in shape, and structuring their days down to the hour.
We do it like they're in-house. We send them a schedule every day of what they're doing. Different. We go, hey, here's the time to wake up, here's the time to eat, here's the time to academic window, here's a meeting, here's a Pilates class.
And from all this, something new and beneficial came about, dubbed the Rebel Roundtable by Coach Arroyo.
I get our coaches on twice a week with all different groups, no one in a position group, and no other position groups mixed. And we sit in their small groups, and they all have their own Zoom calls, and they talk about everything other than football, and get to know each other and talk about great things in their life, mentors, hardest thing they've had to deal with, and really get to know each other.
So while this all may not be ideal, Arroyo and his Rebels are taking advantage of this time to lay the foundation for his program in unique ways, with hopes that whenever it is time to strap up, today's virtual work will pay dividends on the field. For News 3 Sports, I'm Jesse Merrick.
All right, Jesse, thank you very much. And while the coronavirus is putting pounds on folks like myself, not LaToya though, but Mike to train and get their bodies right for a boxing return. Kevin, what do you think? Oh, yeah. Tyson's 53 years old and hasn't fought since 2005, while the real deal Holyfield is 57 years old, hasn't fought since 2011. Remember, Holyfield and Tyson fought a couple of times. The second was the infamous ear-biting fight in 1997.